Imagine it is late at night. The house is quiet, the television is off, and you are finally settling into your favorite chair, or perhaps lying in bed. Suddenly, it starts, not necessarily with the dramatic chest-clutching pain you see in Hollywood movies, but with a strange, heavy pressure. It feels like an elephant is sitting on your chest, or perhaps a sharp ache radiating down your left arm or up into your jaw. You try to take a deep breath, but the air just won't go in. In that terrifying moment, the reality hits you. You might be having a heart attack, and there is no one else in the room to help you. If you're over the age of 60, this scenario is a very real fear. But what you do in the next 60 seconds matters more than anything else. Most seniors believe that simply dialing 911 is enough to ensure survival, but emergency room veterans know the uncomfortable truth. Calling for help is only step one. Surviving until that help arrives is entirely up to you. I have spent over 30 years working in emergency rooms across the United States, watching patients rush through those double doors. I can tell you with absolute certainty that survival is rarely about luck, it is about actionable knowledge. The statistics are sobering. According to data from the American Heart Association and Harvard Health Publishing, nearly half of all heart attack fatalities occur before the patient ever makes it to the hospital. This happens because people freeze, they panic, they wait too long to act, or they simply do not know how to keep their vital organs functioning during the critical gap between the onset of symptoms and the arrival of paramedics. However, there is good news. In many of these tragic cases, the outcome could have been different if the person had known a few simple, scientifically proven actions to keep their heart and brain oxygenated. We're going to explore 3 specific, doctor-backed techniques that act as a survival toolkit for anyone living alone. These are not internet myths or home remedies. These are medically sound protocols supported by research from institutions like the Mayo Clinic and the NIH. By the time you finish reading this, you will have a mental blueprint for survival that could literally double your odds of making it through the night, according to findings in the European Heart Journal. But before we dive into the specific techniques, I want you to ask yourself a serious question. Have you or a loved one ever felt that sudden, unexplained pressure or shortness of breath and wondered, is this it? If so, you already know how paralyzing that fear can be. The goal today is to replace that panic with a plan. The first and critical step involves conquering the body's natural reaction to trauma, panic. When a heart attack strikes, your autonomic nervous system goes into overdrive. Your heart rate spikes, your blood pressure shoots up, and your breathing becomes rapid and shallow. While this fight-or-flight response was useful for our ancestors running from predators, during a cardiac event, it is deadly. It forces an already failing heart to work harder when it is desperate for rest and oxygen. The difference between those who survive and those who pass away often comes down to the immediate oxygen response. This isn't just about trying to relax, it is a physiological override switch for your nervous system. Doctors at Harvard Health describe this as regaining control of the vagus nerve. Think of the vagus nerve as the brake pedal for your entire cardiovascular system. When you activate it, you slow the heart rate and lower blood pressure, reducing the oxygen demand on the heart muscle. To do this, you must engage in diaphragmatic breathing. The moment you feel that crushing pressure, you must stop moving immediately. Find a place to sit upright with your back supported. Do not lie down flat, as this can increase fluid pressure on the lungs. Place a hand on your belly and inhale slowly through your nose for a count of 4. You should feel your stomach expand, not your upper chest. Then, purse your lips as if you are blowing out a candle or blowing through a straw, and exhale slowly for a count of 6. This specific rhythm does something incredible.
By extending the exhale, you trigger proprioceptive relaxation, signaling to your brain that it needs to calm the heart down. A study in the Journal of Cardiopulmonary Rehabilitation and Prevention found that seniors who used this breathing method increased oxygen flow to the brain and heart by nearly 20% compared to those panting in panic. Imagine a 72-year-old woman in Denver who felt chest pain while doing chores. Instead of running to the phone in a panic, she sat down, dialed 911, and then immediately focused on this slow, rhythmic breathing. When the ambulance arrived, she was alert and her heart had sustained minimal damage because she hadn't forced it to redline during the wait. However, sometimes breathing isn't enough. If the attack is severe, you may feel your vision starting to tunnel or a wave of extreme dizziness washing over you. This indicates that your heart is struggling to pump blood to your brain and you are on the verge of losing consciousness. If you faint while alone, your chances of survival drop precipitously. This brings us to the second and somewhat more physical technique, often referred to as cough CPR. While this term can be controversial if not explained correctly, the science behind it, known as cough-induced cardiac compression, is valid and used in catheterization labs. Research cited by the American College of Cardiology suggests that forceful coughing can help maintain consciousness during dangerous heart rhythm disturbances. The mechanics are simple physics. When you take a deep breath and cough explosively from your diaphragm, you create a massive spike in pressure within your chest cavity, the thoracic cavity. This pressure squeezes the heart and the aorta, forcing oxygenated blood out of the heart and up into the brain. It essentially acts as a manual pump when your body's automatic pump is failing. If you are alone and feel yourself fading into darkness, you must fight to stay awake. Take a deep breath and cough hard, deep from the gut, not a shallow throat clear. Repeat this cycle. Inhale, cough, every 2 to 3 seconds. You should feel a tightening in your chest with every cough. This isn't a cure for a heart attack, and it won't fix a blockage, but it can buy you precious minutes of consciousness. There is a documented case of a retired mechanic in Texas who used this exact method when he felt faint in his garage. He managed to stay conscious until paramedics rolled into his driveway. His doctor later confirmed that the artificial pressure he generated likely prevented brain damage from oxygen deprivation. Remember, this is a last-ditch effort to keep you awake. If you are breathing fine and alert, stick to the calming breath technique. The third strategy is one that is tragically overlooked, yet it is often the logistical reason people do not survive. We call it the access and alert strategy. You can have the best medical insurance and the fastest ambulance response time in the county, but if the paramedics cannot get to you, none of that matters. Every cardiologist I know has stories of responders arriving at a house within 6 minutes, only to spend another vital 5 minutes trying to break down a reinforced front door because the patient locked it out of habit. The moment you suspect a heart attack and have dialed 911, you must unlock your front door. If you can safely do so, leave it slightly ajar, then sit in a chair that is clearly visible from that entry point. Do not go into a back bedroom or a bathroom where you might be hidden if you lose consciousness. Furthermore, utilize the technology you have. Put your phone on speaker mode and place it on the floor or a table next to you. This keeps your hands free to check your pulse or hold your chest while still allowing the dispatcher to hear your breathing and give you instructions. If you have a medical alert system or a modern smartwatch, activate the SOS feature immediately. These devices can transmit GPS coordinates to first responders, shaving minutes off the arrival time. Consider the story of a widow in Phoenix who felt the symptoms strike. After calling 911, she forced herself to walk to the front door, unlock it, and sit in the hallway. When the fire department arrived, they walked right in and started an IV within seconds. Her cardiologist later told her that the time saved by unlocking that door was likely the difference between a full recovery and permanent heart failure. It is about removing barriers. You are preparing the runway for your rescue team so they can land and get to work immediately. Survival does not end when the ambulance arrives, nor does it begin when the pain starts. True survival is about preparation, what doctors call cardiac prehabilitation. This means training your body to handle stress before a crisis occurs. The same breathing exercises that save you during an attack can be practiced daily while watching TV to improve your heart rate variability. Simple movements like standing up from a chair 10 times in a row condition your muscles to communicate better with your vascular system. You should also take stock of your home right now. Do you have a bottle of full-strength, non-coated aspirin? Chewing one 325 milligram aspirin at the onset of chest pain is one of the most effective ways to stop a clot from getting bigger, yet many seniors don't keep it within arm's reach of their bed or favorite chair. Do your neighbors or family know how to get into your house in an emergency? Do you have a hidden key or a code they can access? Surviving a heart attack alone is not about hoping for a miracle. It is about understanding the physiology of your own body and preparing your environment. It is about overriding the panic response with the immediate oxygen response to protect your heart muscle. It is about using the chest pump technique to keep blood flowing to your brain if you feel faint. And it is about executing the access and alert strategy to ensure help isn't stopped by a locked deadbolt. Knowledge is the ultimate survival tool, especially once you cross the age of 60. By reading this, you have already taken the first step. You now possess the blueprint that separates victims from survivors. Don't just file this information away. Practice the breathing, check your aspirin supply, and unlock the mental barriers that lead to panic. Your life is in your hands, and now those hands know exactly what to do.